Hello, my name is Wendy Patrick, and I am a career prosecutor and also a behavioral analyst and many other hats. But today I'm going to be wearing one of the most important hats that I've worn for most of my career, and that is that of behavioral health and making sure that people understand how they can feel better on the job, off the job, no matter what they do. Very practical way of maintaining balance. And in that vein, given that wellness is just so important to all of us, we're going to be talking with Robert Perkins, CEO of the Center for Chief Mental Health Officers. Greetings, Robert.
Hi, Wendy. How are you?
Robert, one of the things that we've been talking about almost nonstop for over a year, and I would imagine a conversation that will continue far into the future, is the stress level that's been impacted by COVID-19. Now, we know that this has certainly brought stress to a global population. This is something that, as pandemics tend to do, has been felt around the world. So, one of the things that we're asking right about now that we've known, or I should say, learning more about how to deal with this, learning new ways how to deal with it, what type of stress has been the most dramatic for employers as well as employees during this pandemic?
Well, I think that, this particular, we talk about this type of stress, it's very dynamically different than anything the world has ever experienced before, because here is one item that has affected the global population. So there's not one person really on this planet that hasn't in some way or another been affected by the stress and the trauma that's been created by COVID-19. But specifically in the workplace, I think, we're people who are seasoned professionals in their jobs. They're used to dealing with stress. They've developed a routine in order to deal with it effectively. The problem is, and these people have become very resilient. The problem is, many of these people are running out of resiliency. And what we're seeing is that COVID-19 brings about it just multiple compounded layers of stress upon stress upon stress. So we can't just think of it as sort of a single source, one particular COVID-19 is causing us stress. No, it's everything from the financial to the health concerns to having your kids home all day while you're trying to work, or having your spouse home all day, or your spouse maybe doesn't have an opportunity to work. It's just unbelievable amount of the different layers of compounded stress that present itself. And we know that, when you have stress in your home life, that's going to have an effect in your workplace. So when you combine the stresses, the normal stresses that you exhibit in the workplace, combine that with the stresses that you're now having at home, and you combine that in the big sort of vision of what COVID-19 is doing to this planet, it's put in both employers and employees in a position that they've never really been in before.
Robert, that is true on so many different levels. When you talked about the stress that you exhibit at home and you feel at home because everything's different, it's sort of a perfect storm of stressors and then some, almost of biblical proportions if we actually think through what we've had to endure during the course of the pandemic. I was also going to make the comment that not only do you have stressors at home, but the lines have blurred. Your home is now your workplace, or at least it was for a significant part of 2020, if not still. And that in and of itself has caused some significant role boundary confusion. We'll call it confusion because many people don't even have a place that's private that they can even work at home. So those stressors that they're exhibiting, there's almost no boundary to when they're at home and when they're at work, when they're on the clock, when they're off the clock. So some of those stress relieving activities we once enjoyed when home was sort of that haven, when it was sort of a castle, an oasis away from the workplace, no longer. So with that in mind, what type of resources and strategies have employers traditionally provided to help their employees deal with stress, and have they been effective?
Well, I think that most employers that recognize employee wellness is a very vital part of success in an organization. I think their traditional response is they set up what's known as an employee assistance program. And an employee assistance program is various services that are provided to their employees, either for free or at a much reduced cost with a small deductible. The only problem is that on average in the United States, The percentage of employees that utilize employee assistance programs is between 8 and 10%. So, I mean, that's sort of pre-COVID. You look at now, sort of COVID, these resources that employers, they had very good intention in putting them into place. They're really not that effective. And we talk about corporate goodwill. Corporate goodwill is very important. And so, employee assistance programs, there's a cost associated to that. And employers have sort of put forth this corporate goodwill. The problem is that corporate goodwill needs to be replenished. And if that corporate goodwill is not replenished, what's going to happen is like a bank account. It's slowly going to dwindle down to zero. And there may be a misconception that on behalf of an employer, well, we've got an employee assistance program in place, that's sort of good enough. And we're in a new time now, and that it's not good enough. So, employers are really good at being patient, but employers really, they have to stop being patient and start being generous if they really want to make a difference on the lives of their employees, which the bottom line is it's going to affect their own productivity and their own bottom.
You mentioned the analogy of a bank account. I would also say that that type of patience is an investment in employees because it makes the workplace more productive for everybody and also more profitable for everyone as well. So it's a win-win no matter how you look at it to take that time. Let me also add, I would add proactivity.
Yes.
Sometimes we hear about these employee assistance programs, but there's really nobody out there promoting them or describing them. And it ends up seeming like something that is, stigmatized, that somebody had to go talk to employee assistance when actually it should be something that all of us do. And you also mentioned that word wellness. And I love that because workplace wellness, hashtag workplace wellness, we're all talking about that. It's been a popular buzzword in many corporate cultures that recognize the importance of this in the workplace. But has that recognition alone been enough to make a difference?
Really, it has in some cultures, depending on sort of the resources, both monetarily and the actual resources that they've made. It's made a dent. But I think it's more been about being aware of wellness and how important that mental health is just as important as physical health. And so, using this word wellness and as a level of awareness. But what's really been lacking is the application of how do we obtain wellness? How do we measure wellness? And what can we do both to promote and enhance wellness within our own organizations, but as well in our workplace and as well as in the lives of our employees?
Right. And we also hear about psychological health and safety. Lots of new concepts, but sometimes the meanings aren't really that new, and nor are they necessarily repackaged. It's best practices some of the time. So, what is psychological health and safety? And is that a relatively new concept?
It is a relatively new concept. If you think everyone understands the concept of workplace health and safety, and wherever you live, generally your state is going to have regulatory regulations that you have to meet in order to meet what they have as the standard for health and safety in the workplace. Well, psychological health and safety is basically using that premise and thinking about what are the psychological factors that can affect my employee in the workplace. And if you think of it in the same terms as you think about health and safety, it becomes a real huge element. Now, currently in Canada, Canada is the first country in the entire world that has actually established a national standard for psychological safety. And many of this national standards being used all around the world. I think what we're going to find, especially post-pandemic, when the greatest need as far as having these tools to apply, because people are going to be so traumatized from COVID-19, I think what you will find is eventually, in the same manner where we've regulated traditional workplace health and safety, is you'll see that similar regulation that's going to apply to actually psychological health and safety.
I love that. We can't have this soon enough. And that's just a beautiful way to put it. It actually really makes it sound very practical, which I'm guessing that it is. And along the lines of practicality, what exactly is a chief mental health officer in an organization? And is that person a medical or a mental health professional?
That's a very good question. To answer, a chief mental health officer is the designated person within an organization that's been given the responsibility of evaluating, monitoring the psychological safety of the employees. It is not a mental health position. So the person is not a doctor, or there may be people who come to that field, depending on the size of the corporation, that may bring those qualifications to the table, but that's not a necessity. Generally, this is going to be probably a manager or a senior executive that's in a person of a place of authority, where generally it's an HR or a training or a health and safety function. Chief mental health officer is a relatively new term. We have a CFO, a chief financial officer, and that person's job is to sort of safeguard and monitor decisions that are being made regarding money in the company. So would it not make sense to have a chief mental health officer to safeguard the environment and the decisions that are being made that really are affecting your most valuable asset in the company, which is your employees?
Amen to that. So, what companies currently have a chief mental health officer?
Well, currently in North America, there's really only about four companies that sort of broke the barrier for that. The very first one was KPMG. KPMG is a very well-known international consulting company. They do a lot of audits financially as well as consulting. They are noted as being one of the first people that implemented the position of a chief mental wellness officer. And it was to a senior partner that was actually suffering from very bad depression, had to take some time off, and was going to resign. And the board came together and they said, listen, we realize you're going through this. Get through it. Let us help you get through it and come back to our company. What is it that you can do to prevent that from possibly helping to other people? There are other companies in Canada, the Workmen's Compensation, it's called BC Safe Work. Companies like American Express, Hills Brother Coffee, TD Bank, many other large corporations have quickly recognized the value and the importance that maintaining a psychologically safe workplace is going to mean to their bottom line and to their employees. And remember, one of the biggest costs when it comes to stress in the workplace, and $50 billion a year is lost in productivity from employees that are suffering from some element of mental health. One of the largest costs associated with stress in the workplace is when people leave. And the cost of attrition, the cost to recruit, to replace, to get somebody trained to the same level as that individual who has left, while having to pay someone to do that work sort of in the meantime, is astronomical. So it's a very, very cost-effective and cost-saving initiative to put into your culture and your workplace.
What qualifications are necessary in order for somebody to become trained and certified as a chief mental health officer?
Well, when we decided to put the training program together, we modeled it in the same way that a CFO, a chief financial officer designation would be. And generally, the requirements are the person has to have a master's degree, and they have to have 8 to 10 years experience in their respective field. So that is the basic qualifications. However, there are considerations to be made, for example, for the business owner that's been doing this for 35, 40 years, knows his business inside and out, has sort of been his own CFO for a period of time. We make adjustments to compensate for where there may be lacking a master's degree. That can be made up in as far as years of experience in a particular respective field. But the basic qualifications, it's very similar in nature to the CFO, being a master's degree and 8 to 10 years experience in your respective field.
And how long does the training take? And is it something that you can do in person or also online?
Well, we are in COVID time, so right now, all of the training that we're being done is distance training. It's being done online, so a person can spend as much time or as little as time and do it sort of on the installment program. So the program is designed to be completed on a part-time basis, I would say between 3 to 6 months. But if an individual or perhaps a company gave a person a sabbatical to just focus on this, it could be completed in under 3 months.
Wow. Now I know everybody is interested in cost. What is the cost of this program?
Well, the normal cost of the program is $3,000 US. However, recognizing the fact that the positions that businesses are going to be in this sort of COVID environment, and they need to do these things now, and now is the right time. They've cut that cost in half for $1,495 US. Gets a person the 6 courses in training. The 6 courses are things like introduction to psychological health and safety, enhancing a manager's emotional intelligence. I mean, one of the big things now, if you look at some of the Fortune 500 companies, they will tell you, what is the most important skill that a leader brings to the table? And it's not their IQ, it's what they call their EQ, their emotional intelligence, their ability to be empathetic to the needs of their employees, to the needs of their customers. These are the sort of skill sets that people are going to acquire, as well as understanding how to build your own psychological health and safety program, plan for it, implement it, evaluate it, and monitor it on a continual basis to create a very psychologically safe working environment for your employees.
It really sounds like this program is teaching us a skill set that will benefit us both personally and professionally. And I don't just say that because we're working from home. This is really something that can benefit us no matter who we're interacting with in all stages of our life. But specifically in terms of the companies, what are the benefits to implementing this position in a company? And is it a full-time position?
Well, the position itself, the title of Chief Mental Health Officer, is not necessarily meant to be a full-time position. So companies that are sort of thinking about this, you don't have to plan for, a salaried position where a person just does this full-time, depending on the size of the company. Certainly, there would be, large multi-billion-dollar conglomerates where it could justify a position. This is meant to be a title and add-on to somebody who's sort of responsible in an HR or health and safety and training. So it's not necessarily a full-time position, although it's an added responsibility and it's a designation of certification to that individual.
So where can people go to get more information or to enroll in the training?
Well, they can go to our website, which is CCMHO.com. Our phone number is there. You can get more information or you can actually enroll online.
That's great information, Robert. Thank you so much for answering those questions and for really teaching us more about how to be more productive employees, which, as I always say, benefits our lives both professionally and always personally. Thank you.
Thank you.